COVID-19 patients in the hospital, and hospital capacity is closing in. KLBK's Alyssa Tellez spoke with Covenant Health and breaks down the numbers for us. Alyssa, how are they feeling about the rise in hospitalizations?
Terry, Walter Cathy with Covenant Health tells me they have seen a steady increase of folks in the hospital. And while the increase may worry some people, Covenant Health is prepared.
The number of people in the hospital for COVID-19 continues to rise.
And we've just doubled the number of patients hospitalized in Covenant and UMC.
As of Thursday evening, the space between the number of hospitalized COVID-19 patients and hospital capacity continues to close. Within just 4 days, 11 additional people are in the ICU, beginning the week with 20. That number growing to 31. On Monday, the number of COVID-19 patients in the hospital was 41. By Thursday, there were 64 patients in the hospital, an increase of 23 patients.
Those individuals are still mostly elderly. Their mean age is about 65.
But even as the numbers continue to rise, Walter Cathy, CEO of the Lubbock market within Covenant Health, says they have the beds.
So we actually have an 8-stage surge plan that we have developed here at Covenant Health System, primarily dealing with 2 major hospitals, that'd be Covenant Medical Center and our Covenant Specialty Hospital.
With a little less than 80 beds with ICU capabilities available between the 2 hospitals, Cathy says they can still open up even more.
Other than that, we have another about 100 beds inside of our just general medical operation that also has a surge plan attached to it as well.
Right now, they're between 75 to 80% of their total capacity, and 48 patients are fighting the coronavirus. Over at UMC, they have 500 beds available, but with their COVID-19 surge plan, it allows them an 11% increase in capacity, rounding up to 650 beds.
We are probably a little bit overbedded, and this is one of those rare occasions where you're probably blessed that we are overbedded.
But as the hospitals deal with the unknown, Cathy says it may have changed the way hospitals work for the future.
Mr. Cathy tells me he doesn't expect any patients coming from bigger cities to Lubbock for medical care, which is a good thing. Cathy tells me most of their patients in the ICU are folks with a compromised healthcare status and now have respiratory issues. Cathy also adds most cases are from outside Lubbock at Covenant, 17 from Lubbock and 31 within the region. Terry?